It is my proud privilege and honor to introduce our next speaker, Dr. J.N. Mahapatra, with over 40 years of experience in the field of nuclear medicine and who has traveled across the length and breadth of this country in teaching and training a whole generation of nuclear medicine physicians. He has completed his graduation and post-graduation from the University of Delhi and is now the founder, president, and chairperson of the World Congress on Cardiac Imaging and Clinical Cardiology. And he is the very reason why we are all assembled together across all specialties in this fantastic heart failure symposium. Thank you very much, sir, and thank you for your leadership.
Thank you, Dr. John. Thank you, Dr. Prabhu. Thank you, Dr. Satish Govind. And in the next few minutes, I will be speaking on role of PET-CT in CHF. So, you heard Dr. Sanjay Gambhir role of SPECT. Now I will be concentrating on the role of PET. So, heart failure is a complex clinical syndrome that results from any structural or functional impairment of ventricular filling or ejection of blood. Approximately, the statistics says 5 million patients in USA and over 15 million patients in Europe have heart failure. So, what is the reason? It is the leading cause of hospitalization in elderly people. Despite treatment advances, the mortality rate of heart failure has increased steadily. What are the causes? One of the possible causes could be more number of patients are surviving myocardial infarction due to our better standard care, and consequently that may increase number of patients who subsequently develop heart failure. So imaging plays a widely used in decision making in the heart failure, not only in relation to left ventricular LV systolic or diastolic function, can decide in the selection of medical versus surgical therapy, intracardiac devices in heart failure, which you will be hearing in the latter part of the day, and valvular heart disease. The further developments in the care of advanced heart disease, including stem cell therapy versus cardiac transplantation, which you will be hearing from the eminent transplant surgeon. Today, device therapy to control the remodeling, then percutaneous valve mechanism. So the epidemic of obesity, diabetes and obesity will augment the existing epidemic of heart failure. So what are the novel structural measurements in the diagnosis and management of heart failure? Although major changes in the management of heart failure have occurred over the last 2 decades, it remains a malignant disease. Patients present with extensive ventricular damage, whether ischemic or non-ischemic, to recognize and treat LV dysfunction. So various modalities already you have heard from CMR, CTA, tissue Doppler, then this is called GLS, 2D, but nuclear care techniques are also state of the art. So what the clinician they need from the heart failure, patients of heart failure, they need what is the detection, what is the diagnosis or etiology, systolic versus diastolic, means HEP-REP versus HEP-PEP, the causes of heart failure, ischemic versus non-ischemic, exclude valvular contribution, then severity, risk stratification, therapeutic guidelines and complication, ejection fraction, filling pressure, detection and evaluation, LV hypertrophy and pulmonary hypertension. So these are the 8 parameters. PET, positron emission tomography, as a molecular imaging technique with various useful by the help of PET tracers, allows non-invasive evaluation of function, myocardial perfusion, myocardial metabolism, myocardial innervation, myocardial inflammation, angiogenesis, cell death, and ventricular remodeling. So these are the new insights of the chemotherapy related. Today we are discussing Dr. Sansgiri about the chemotherapy cardiotoxicity. It is a promising tool for understanding the physiological consequences of heart failure, resulting in early detection of patients with heart failure at risk, gives therapeutic strategic planning and treatment. About cardiotoxicity, stem cell monitoring in living bodies for cell-based therapy, which is coming to the clinical trials. So first in the list is coronary artery disease and microvascular dysfunction. PET perfusion tracer like nitrogen ammonia, rubidium-82, oxygen-15 water, F18 fluoridase allows regional and global myocardial blood flow in millimeter per minute per gram at stress and rest. CFR, coronary flow reserve, measures not only the vasodilator capacity, but also endothelial function of coronary circulation, allowing patients having microvascular dysfunction or detecting, which is highly prevalent among at-risk individuals in the absence of overt atherosclerosis, as well as in patients with diastolic heart failure in the absence of reduced EF. But means diastolic heart failure with a ejection fraction normal. So CFR scores over ejection fraction. So reduced CFR is shown to have better prognostic implication, being a sensitive predictor for cardiac death as compared to reduced left ventricular global ejection fraction. So a little bit of calculation of CFR, because it's a clinical meeting, so I should not go into the details of the pharmaceutical and all. See, coronary flow reserve is a myocardial blood flow during adenosine pharmacological intervention at versus myocardial blood flow at rest. So first to do that adenosine, then resting. So the normal range value is from 2.70 onwards, matlab up. So this is a patient where you can see there is a balanced ischemia, reduced ejection fraction, all the territories, but still all the territories is showing less CFR 1.3, 1.1, RCA 1.9, LCA 1.4. But the myocardial perfusion is normal. I mean almost normal, except the inferior area. So the CFR is low in other cases. So that this is a very good important information in case of balanced ischemia. This is another patient where you can see that a posterolateral and inferior perfusion defect and a rubidium study, stress and rest. But here we calculate the LAD, circumflex and RCA, so 1.07 and 1.18 and this thing. But here we can say to the cardiologist, which is the culprit lesion, he has to intervene fast. When there is a perfusion defect with a low CFR, that is called the culprit lesion, as compared normal uniform stress perfusion pattern with reduced CFR. So this is another patient, another indication of PET in transplant vasculopathy following heart transplant. So cardiac allograft vasculopathy is one of the leading causes of late mortality after heart transplant disease, characterized by diffuse, what happens here, concentric intimal thickening of both epicardial and intramyocardial arteries, which is difficult to be assessed by traditional coronary angiogram. Of course, IVS can do it, but IVS will not be suitable to diagnose diffuse intimal thickening. So, stress MPI spec underestimates the disease severity extent. So, where PET calculate the myocardial blood flow using dynamic nitrogen 13 ammonia to find out the myocardial blood flow and the coronary flow reserve. So, PET in cardiac resynchronization therapy. CRT can correct cardiac dysynchrony and improves LV systolic function. PET is a novel, non-invasive technique along with SPEC can provide vital information such as myocardial blood flow, glucose utilization, oxygen consumption. So C11 acetate, a PET tracer, can be used in patients to evaluate the efficacy of putting the CRT with severe heart failure. What happens? A homogeneous myocardial glucose uptake implies CRT may induce a more balanced wall stress and energy requirement. But another study demonstrates that decreased oxygen consumption assessed by C11 acetate requires the CRT. So what is this is a new concept of sympathetic innervation in imaging by PET tracer in viability study when you give the viability. So cardiac sympathetic neural dysfunction has been shown to be abnormal even in viable myocardium. When you give a report, oh, the viable myocardium is there, this patient would get benefit out of revasculature. But no, new PET agents such as C11 hydroxy ephedrine and C11 CGP 12177, a beta adrenoreceptor antagonist, can visualize regional defects in myocardial sympathetic innervation, can pinpoint effectively as compared to iodine 123 MIBG imaging the area of neuronal dysfunction in spite of having viable myocardium. I'll show you one image also. So neurohormonal and viability hibernation imaging may play a complementary role. How? So another is decreased cardiac beta adrenaline density using C11, CGP, PET tracer is also observed in a study of patients with non-ischemic cardiomyopathy. In addition, the receptor density is significantly correlated with systolic function, and iodine 131 or iodine 123 MIBG washout rate and delayed washout rate, heart to mediation ratio, but not early. So another third PET tracer is called F18 bromobenzyl guanidine, which is a F18 analog of iodine 123 retained in the heart throughout norepinephrine transporters. Now you can see here. See here the system by is almost normal perfusion, but here see the defect. This is iodine 123 MIG. So here the viability is there, but MIBG dysfunction is there. So this patient needs CRT, otherwise the patient may go at any time to arrhythmia and death. So this is called the mismatch. So role of PET in chemotherapy-related heart failure. PET tracers using C11 acetoacetate, a ketone body tracer, is expected to have similarity to C11 acetate. In mitochondria, acetoacetate is first converted to acetoacetyl coenzyme, then to acetyl coenzyme. In cytoplasm, acetoacetate can also be directly incorporated to lipogenesis pathway, thereby identifying doxorubicin-induced heart failure at an early stage in a resting state. So role of PET scan in assessment of myocardial viability, gold standard. So you know the viability-directed revascularization would improve cardiovascular outcomes, reduce heart failure symptoms, reduce admission to the hospital, and improve quality of life. So the amount of myocardium minimum should be 20% so that the patient would get benefit out of CABG or revascularization. So these are the tracers, rubidium, F18FDG, F18 fupridase, all are there. Here you can see one scans where you can see anterior, there is a viable myocardial metabolism there, but septal resting scan and the PET scan, there is no viability. You can see here, anterior, the resting perfusion defect, the imaging is beautifully come. But in the septal, the perfusion is less, but there is no metabolism here. So this is one study. The other scan, this is called a match defect. There is no perfusion, no metabolism. So this is a dead scarred myocardium which should not get benefit out of CABG or revascularization. This is a very beautiful patient referred to us for a bilateral pleural effusion with a heart failure patient. So we did the first day the resting scan showing a ejection fraction of 21%, and the heart is enlarged and there is no thickening much in the septal and anterior apical. Then on the next day we did the PET study. See the PET study. See the beautiful absent perfusion here, showing metabolism here, and beautiful absent perfusion, absent metabolism. Now you can see here. So even if 20% ejection in heart failure patients, we gave the report of metabolism hibernating myocardium, the patient was operated. Believe me or not, the patient came back to normal. The ejection fraction slowly 30, 35, 40, 45%. So PET has got the gold standard in the assessment of myocardial viability in patients of heart failure. Role of PET in post-MI remodeling. This is matrix metalloproteinase, you know, it's a remodeling. So may adapt in early phase of the cardiac injury. Continued remodeling after myocardial infarction is a pathologic process that is associated with poor prognosis and diminished cardiac function. Myocardial infarction results in the activation of the renin-angiotensin-aldosterone system. So matrix metalloproteinase, MMP, are a family of proteolytic enzymes. When myocardial infarction occurs, they degrade the myocardial extracellular matrix, ECM, resulting in adverse cardiac remodeling. So during the process of heart failure, the level of MMP is increased. As soon as the level of MMP, there will be degradation of ECM by MMP, results in wall thinning and dilatation and heart failure. So post-myocardial LV remodeling may lead to heart failure. So you can see what are the radioisotopes, indium-1 labeled MMP or technetium labeled MMP activity. So here you can see the thallium perfusion is, there is a perfusion defect here, but here technetium MMP is showing activation. So 1 week, 3 weeks. So more persistence of the MMP activity or this amount, so that produces more remodeling. So this type of hybrid non-invasive targeted MMP image will probably hold important clinical implications for evaluating new therapeutic intervention designed to reduce post-MI remodeling leading to heart failure, especially to monitor the dose of ACE inhibitor which cardiologists they prescribe. Role of PET in angiogenesis. Angiogenesis occurs in response to ischemia. Radiotracer used in affecting galacto RGD. The effect in galacto RGD is monitoring the therapy, aiming to stimulate angiogenesis in IHD and preventing the development of heart failure. Then myocardial infarction. You know, all myocardial infarction is associated with a inflammation, myocardial infarction. So FDG PET is very useful. But recently the somatology receptors expressed by activated macrophages leading to the utility of gallium citrate dotactate can also pinpoint the disease. So gallium citrate dotactate and effect in FDG both are post-infarction agents where you can detect the inflammations and then you can prevent the myocardial heart failure. So here you can see this is a subendocardial infarction showing the uptake of the effect in FDG. This is called cardiac inflammation following MI. So they are the AHA, American Heart Association treatment goals. These are the healthy lifestyle, preventing vascular coronary disease, preventing structural MI. You can do only absolute flow quantitation. So in case of structural change, prevention of heart failure, then symptoms, you can find out etiology, subclinical cardiac dysfunction, imaging for perfusion, revascularization, metabolic innervation. These are the controlling symptoms, gated PET, then improve quality inflammation imaging. So this is a chart, AHA treatment goals. So concluding, advances in the application of cardiac PET may play an increasing critical role in the diagnosis, prognosis, and clinical treatment of cardiovascular disease. Molecular imaging approaches using PET could evaluate myocardial pathophysiology at different stages of heart failure. So PET imaging procedures would answer the questions such as etiology, severity, reversibility of LV function, and prognosis. The development of various therapies, especially cardiac device therapy or angiogenesis or stem cell therapy, require a combination of imaging and monitoring therapy, which will definitely help the patient. Thank you very much. I would invite all the esteemed delegates, chairperson, and the speakers to come and attend our 3rd World Congress Physical Conference on Cardiac Imaging Clinical Cardiology this year in October 28 to 30th October 2002. Hopefully, we will be able to do the first physical meeting in the form of 3rd World Congress. Thank you very much.